Hey, what's up, everybody? Today is 13 October 2022. I'm in here in front of the hospital, the Freie Universität Medical Center, and I'm about to go in for the lung function test, the spirometry test. And immediately thereafter, I've got an appointment with my pulmonologist. The last time I did these tests was in March 2022, so it's been about 7 months. We kind of stopped the quarterly interval because after about 6 or 9 months, there was really not much improvement, marginal improvement on my lung capacity. I got stuck around the 71% level of normal function for a man my size and my age. So we kind of skipped a quarter. 7 months later, gonna go in here, do the test. I'll try to catch as much as I can. They generally don't allow cameras in there. Usually it takes a day to get the results, but actually immediately after the test, I got to cross the street and go to the polyclinic back there, which is actually where the office of the pulmonologist is. So I'll try to capture as much of this as I can, and we'll know the results a little bit later. Hasta. All right, just finished the lung function test at the lung department here at the Freie Universität Medical Center. As I expected, I did ask if I could take video, and I was not allowed. I was told I would need permission from the hospital. I have no idea how long that would take if I tried to do it, and if I would even be allowed to do it. The technician administering the test asked me why. Why would I want to video it? And I just explained, look, my condition was this. I was in the ICU for 50 days a couple of years ago. And, I've got friends and family around the world. Making video, sort of documenting, is a way to share my experience with the whole virus. And sometimes if I can show a test that I do or rehab that I do, then, it helps people understand the experience a little bit more. Anyways. And I'm back. It's a little bit noisy out here today. Maybe you heard the helicopter. So I'm going to try out this clip-on mic here. So let me tell you a little bit about today's test. I could see the results on the screen, and so I have a kind of preliminary assessment, if you will, of the results. Now, we also saw inside with the technician the graph of the 5 previous times that I've done these tests, going back to the first time of February 2021. So today was actually the 6th time I've done these tests since February of 2021. And indeed on this graph, you can see that the metric, which is called VC max, which is the metrics my pulmonologist refers to the most. This metric of VC max, you can see over the last 3 times, just hovered between being under 70% for normal lung capacity to 70% to just barely over 70%. And these tests were all about 3 months apart. So you have over, I guess you could say, about 6 months, very minimal improvement. And I ended up around 71% of normal function. So that's the past. I looked at the screen, I could see the results, and the number that I saw today was 74% of normal capacity. So compared to the last 3 times, today's improvement is the most that I've seen in a while. It's 3 percentage points, 74 from 71. But if you look at 3 over 71 for the rate of improvement, actually it's an improvement of about 4.2% of actual capacity function improvement, I should say. So that's great. I haven't had that kind of improvement since the very early days of my recovery, when I was still in the rehab and not even going to the gym yet, and just trying to relearn how to use my body all over again and just walk and get out of bed and manage myself day to day. So I feel pretty good about that. The other thing I can tell you is that the actual execution of these tests today went better than I recalled as well. There's actually 3 different tests that I have to do. We're all in the same machine, where this tube I have to breathe into with my nose flipped. And there was one test where I had to breathe out as much as I possibly could, take a deep breath, pause temporarily with my lungs full, and then just breathe out normally. That was test number one. Test number two, I had to breathe normal, take a deep breath, hold it for about a second, and then forcefully exhale as much as possible. And this is the one that gives the pulmonologist the BC max metric that she normally measures and looks at. This is the one that's how much air can I take and how much force I can create on that second test. And then the third test, I had to take a deep breath, I had to hold it for 10 seconds, and then exhale normally. Now, I can tell you from the past, my lung function and my overall capacity was that I couldn't finish all these tests in the past. I remember getting to the test where I had to forcefully exhale as hard as possible and being kind of cut short, or the limitation was I would start coughing, or kind of choking or coughing. And I remember in the past not being able to complete the test where I would take a deep breath, hold it for 10 seconds, and then breathe normally. I couldn't hold that breath for 10 seconds in the past. So somehow that would kind of get skipped over, or I just couldn't complete it. I don't know how the metric got captured for that one, but I could tell today in the execution of these tests, an improvement. I could complete them. All right, so that's my preliminary assessment of the test, what the results are, how the execution for me went. I got to go across the street, like I pointed out earlier. Polyclinic is over there, pulmonologist is over there, so now we'll have the official discussion about how it's going. I'll have a chance to tell her how I've been feeling, what is my day-to-day life like, what have I been doing exercise-wise, and actually I need to get her referral to the medical device company. I still have at home several bottles of oxygen. I have bottles at home from oxygen where they're under pressure. I would attach a hose and with a nozzle, and every week I would have to get them replaced. These were the bottles I was using for the first 6 months or so. And then as my condition improved, I got a machine at home that could refill bottles, smaller bottles. So as my lung capacity and my breathing improved, I didn't need such big, heavy bottles anymore. I could get around with smaller bottles. I think the bottles I had at home were 2 liters. They hold 2 liters of oxygen. They're small enough that there's actually a device that can refill them with air at home. That's what I have at home now, but I still have from a year ago this big 5-liter bottle and a couple of 2-liter bottles, I think. I don't know. Something that I can't refill. And the medical device company won't take them back until I get a referral or approval by the pulmonologist. So I'm going to ask her for that today too. All right, I'm on my way. Hasta. Well, I'm back. You were commenting on my weight. I'm back to about my normal weight before pre-COVID.
Yeah.
I think I'm a little bit fatter. I think if I remember correctly, before COVID, I weighed 90 kilos and I was about 20% body fat. This morning, I weighed in at about 92 kilos and my body fat's about 23. Pretty close.
Yeah.
Pretty close. But
how are you feeling?
I've learned, I think, to live with this new threshold that I have. I've been going to the gym. I talked to you a year ago before, should I do it? So I went through many months of kind of like relearning. I had to, I realized my breathing was so much more important than before. And most of my training in the gym is trying to build strength. Mm-hmm. So core stability is really important. And typically then the way I perform some of these lifts is having to hold my breath so I can brace
Well, when your lung capacity drops, it's harder to hold your breath. And my overall cardiovascular capacity drops. It gets harder to do 10 reps or 12 reps. So I've been learning to adjust to that. I've been learning which exercises are really hard for me to do, and so I do them less often. And anything that's a compound movement where my head is going up and down, like if you know what a back extension is, there's a bench like this, you're facing down, you bend your body, and you go like that.
Right.
So my head is going up and down, and it's a compound movement. I don't, I'll do this 4 weeks at a time, and then take a break, because things like that are really hard, and I don't like doing high reps of squats, because it's the same thing. It just make me dizzy and I can't breathe, and I find the limit. If I test myself, my limit is not my strength, my limit is my breathing. I get to 10, and then it's not my muscles that are tired. I know I can do more, but I just can't keep up.
Right. Do you have the feeling that you were ever hyperventilating?
No. I don't think I have had hyperventilation since 2 years ago, October, when I was at home, sick, before the ambulance came and got me. Lying in bed, walking 10 meters to get to the WC, and then getting back to bed. That was like running a marathon. And then I was hyperventilating, catching my breath just from walking back and forth 10 meters.
Right.
I don't really have that now. If I do, it's because I've really pushed myself.
Okay.
So I've been feeling better, and I've also been pushing myself more. Besides all the weightlifting, about 3 weeks ago, I started trying to jog.
Okay.
At the end of my weightlifting workouts, I would get on the treadmill. For several months now, I would say about maybe 6 to 9 months now, I've been finishing my workouts in the gym by walking on the treadmill, setting the speed between 4 and 4.5 kilometers, depending on how I feel, walking 15 to 30 minutes. Just as a way. And then I would really, as I would walk, I would really focus in breathing into my stomach, expanding out. But I felt like 3 weeks ago, you know what, I don't have confidence running. I know it makes me uncomfortable. So let's try to start building that up. So I started increasing the speed from 4 to 5 to 6, 6.5. And then I found when I got to 7, I couldn't walk. I had to start jogging. So that's what I've been doing now for about 3 weeks. I call them jogging intervals. I'll turn up the speed between 7 and 7.7 kilometers per hour, and I will jog from between a minute and a minute and a half, depending how I feel. And then I'll put the treadmill back to 4 kilometers per hour. I'll put on my O2 sensor.
Right.
I'll wait for the O2 to get back above 90 and my heart rate to drop back below 130 before I do it again. And I'm finding that reset phase of everything, getting better, takes about a minute to a minute and 15 seconds before I can go again.
Sure.
So I've been doing that, mostly just to build up my confidence and just feel good about running. And I've been going to mobility classes now about 3 to 4 months. I started with that, So I've been feeling better, but but the limitation is still there. I can feel it. We go on vacation. If we walk up some stairs, I have to take my time.
And what's your aim with all the exercising? When are you satisfied?
That's a good question. Well, even before COVID, my hobby was strength training in the gym. I've got some goals that I set 5-6 years ago that I want to achieve. And I got really, really close before COVID. Since I'm back to kind of normal again with my strengths, I'm really, really close again. you know. So 5-6 years ago, I set some strength goals,
Okay.
and I still have them. So that hasn't changed. And I came up with 5 years ago when I was 51, I thought to myself, it would be really cool if in my 50s, I could lift 500 pounds, which is 227 kilos. But this isn't a deadlift off the floor to a standing position, right? I've come really close to that many times. I did 200 for a repetition of 2 about 3-4 weeks ago, so I'm getting really close again. But yes, I've given myself a year from last October to this October to sort of rebuild my body, and then look for next year, 2023, to get back and do a competition, really. That would be my goal.
All right.
Besides the one goal that I told you about, I don't place more goals, because then I find like I'm mentally limiting myself. I want to hit that one and then see how far I can, you know. The stretching is something that I feel like helps me, because at my age and because what I do, it helps. I feel the mobility and the stretching. And the running is just a combination of confidence building, right? I do feel if I can improve my cardio to be as optimized as it can be, that will carry over to having better cardiovascular strength for when I'm doing the strength stuff as well. I don't know. You know, I'm just a person that always has enjoyed fitness, physical related challenges.
I know, we've talked about that before also, and I'm pretty sure that that's also the reason why you were able to get through this.
Sure, there's a psychological aspect to it as well, yeah.
Sure, yeah, but also your strength that you can sort of have. You did another breathing test, a pulmonary function test.
Yeah, I have to tell you, I think not only the results, but the execution of the test today, for me, felt the best ever.
Yeah, well, it shows.
The very last test that I did, I had to breathe out as much as possible, take a deep breath, hold it for 10 seconds, and then breathe normally.
Mm-hmm.
I don't think I've been able to finish that test in the past.
Okay. I can't really tell based on numbers, but usually there's a quality check to see if quality-wise it was performed correctly, and so far it was always good enough with numbers. I know you were quite disappointed at these stages.
Yeah.
I'm 100% back.
Yeah, and I was still going to physiotherapy up until maybe this point.
Yeah.
Right, from here all the way through here, I was still going to physiotherapy, and even then we had started to add more cardio. I was doing hills. What was it? A 10% degree incline on the treadmill for 5 minutes, and nothing was happening. So yeah, I remember back at that time frame, December of 2021, I was very disappointed and frustrated.
Yeah, and to me, looking at this now, it's at 75% drop. We have a forced vital capacity higher, it's up to 80%. It's a 25% increase comparing to February.
Yeah, but when you say
Extremely high.
I'm kind of an analytical guy, so when you say 25%, you mean 25 percentage points.
Yeah.
25 to 75.
Right.
Which?
No, 50 to 75.
50 to 75 is 25 percentage points, but actually it's a 50%.
True.
25 over 50 to compare to what? Then
yeah.
For me, that's a bigger number, right?
I see. Yeah. For me, even the 25% is extremely high. It's really a lot of capacity back, and you are right. It's a 50% increase compared to what it was.
Yeah.
But really, that's a lot, and it shows me probably what we're measuring here is a combination of having more muscle strength, so you actually able to use your muscles to increase your lung capacity. But probably there's also a bit of so I would, and I know I've said that before, but because I said the same thing when you were here, that it's I mean, I can see if you're pushing yourself to your limits, you might feel this, and especially feeling increase your breathing any further. Well, you want to increase normal. So it's normal for a person to feel limited by the cardiovascular system. So at one point, you get your maximum heart rate, or you get your maximum weight that you push with your muscles. But it's not natural to be limited by the amount of breathing.
Yeah.
So as soon as a person feels it, it feels unnatural and uncomfortable.
That's exactly the word I was going to say, uncomfortable.
Yeah.
I definitely in the gym, or if I have to walk hills or stairs or carry something, you know, I definitely can get into this uncomfortable range.
Yeah.
But like a lot of things, I think I've come to feel more comfortable, or at least more confident in that range, especially with the jogging that I've been doing, you know, and then looking at the clock and watching my O2 and the heart rate and seeing, okay, it's taking a minute to minute 15 to get to comfortable metrics again, you know. But yeah, you're right. There's times it's uncomfortable, and I want to say 9-12 months ago, it was mentally very hard for me to be in that uncomfortable range.
Yeah.
Maybe I've gotten more used to it now. Maybe I'm more accepting of it. Maybe I just feel better now that this is just my new normal, and I just have to live with it. But I mean, I could see the preliminary results on the screen, so I kind of saw the new 74%. So that's the biggest improvement we've seen in a while, right?
It is, but it's also over a longer period.
Yeah, true.
And again, it's the same as I mentioned before. It could be that this is the maximum limit, and this is the new normal, just because you do have some scars on your tongue. But if this is the end result, again, like I said before, it's really, really nice compared to what it was.
Yeah. When most people ask me these days, you know, how do you feel? How are you? My typical answer is, you know what? I can live a normal life. I can do normal things. It's just that threshold of the 74% now of my whole cardiovascular system means those things that I used to do before are uncomfortable. I mean, I was telling the technician today that did these. She was more talkative than some of the other technicians.
Okay.
You know, because I asked her if I could video. She said no. Why do you want to? And I explained. You know, people like to know what's happening and hear it and see it and kind of experience it. But she asked me, so then how, you know, like, how are you? And I said, well, before COVID, I could do cardio for 30 minutes at an average heart rate of 155, 160 beats per minute. For 30 minutes, that was my average. Somewhere in there, I would spike higher at 170 and maybe come down for 140 for a while. But as an average, for 30 minutes, I could do 155 to 160. If I get there now for a minute,
yeah, but I really,
you know, then
of course, but that's normal. And maybe you shouldn't be, maybe a little bit tricky, but you shouldn't be focusing on the numbers before COVID, but you see COVID as a big reset and start focusing after COVID. So look at it, what you were able to do a year ago, 6 months ago, and then now, then you can see the trend going up. Because there's like a pre-COVID and post-COVID era for you.
Yeah.
And your body has been at such a low that building that up again can take years.
Yes, and it's interesting you say that, a reset, because in my own mind, what I've been saying about going to the gym again since October is that I'm rebuilding.
Right.
And I've had to do things like learn how to breathe all over again. But since I had to really reset and just start with a bar, actually it's given me a lot of time in this rebuild to work on some of the weaknesses, improve things that I couldn't do before, or it's given me the excuse to say, well, if you're going to reset, really start from scratch. And all those things that you knew were sort of your weak spots before, now's the time, along with your breathing and everything else, to just kind of rebuild. So some of the things I do in the gym, I'm doing a different technique than I used to do before because I had a chance to restart.
Right.
You know, and question for you. You mentioned that maybe some of this improvement is maybe some regeneration, some rebuilding. At what point would you say, okay, out of curiosity, let's see from a CT scan what's happening with the lungs?
So, out of curiosity, I would not do a CT scan.
Okay.
Why? Because it's not going to take there's only two options. Either we see an improvement on the CT scan, or we see stable disease. You should not see a stable situation. Both situations, it's not going to change anything. It is going to expose you to radiation, plus it's investigation where there's not really an indication. There's not really a reason to do this. Curiosity is not the best.
Yeah. What's this?
Because the problem is, apart even from radiation, because we're not expecting to find any things, but we're not looking for anything. There's always quite a substantial risk of finding things that have no meaning. You'll find, I don't know, a small spot somewhere or a nodule, and then all of a sudden we need to do another CT scan or maybe do a PET scan, and then here again, and just keep going. At one point we'll have to say, this is the point. Fantastic. Sure, there are limitations. Considering where you come from, you're doing fantastic. Your lungs are still showing improvement. Not gonna do any news.
Yeah, well, it would just be, as I said, I suppose, curiosity, right?
Yeah.
What they looked like before, what do they look like now? You mentioned we might be at that point. I mean, I'm going to continue to train. I'm going to continue to do these jogging intervals. I think we went 9 months or 7 months this time, right? I mean, we don't have the risk of radiation exposure here, right? Is this something we could do 6 to 9 months?
Well, I'm okay doing it again, but it's at one point there's no reason to do this from a medical point of view. I can understand the curiosity part. Medically, there's really no indication in these tests.
Yeah.
And at one point also the insurance company is also going to say,
yeah,
why are you doing all these tests in an academic hospital with a medical specialist?
So what is there anything I could do at that point? There's no way to get the spirometry test without.
Some house doctors have it. Their center.
Yeah.
Otherwise, I don't know.
Okay.
Stop focusing on these numbers. I know that you love numbers.
Do you know how long? How many times people have been telling me that since the ICU days? Forget about the numbers.
How you feel and looking at your own progression. mean, you're lifting 200 kilos.
And I still want to do more.
Well, okay, then focus on those numbers.
Yeah.
At least you should forget about them.
All right. All right.